Today we will be discussing the Global GAG Rule. What is that, you may ask? The Global GAG Rule basically is a policy that has been put in place by every Republican government in the US. The goal of the Global GAG Rule is to defund any organization that provides abortion services or education overseas. As a result, there has been a lot of negative impact while trying to control the increase in the number of abortions. What are the effects of the Global GAG Rule, you might ask me? In a developing country like Nigeria, for example, sometime as early as April 2018, a lot of women, pregnant women, were protesting at hospitals the hike in maternal fees. So that means they were not able to pay for things like contraceptives. They were not able to pay for antenatal and postnatal services, which you would consider something very basic, right? According to the UNAIDS, Nigeria has the second highest number of individuals living with HIV/AIDS. That number is 3.2 million. With the Global GAG Rule, although they're trying to curb abortion is not the only thing that gets affected as a result of that. When people don't have access to contraceptives, there's a large increase in the number of unwanted pregnancies, but also there's a greater increase in the number of unprotected sex. And that also contributes to the HIV epidemic. Since a lot of these organizations and hospitals are funded by US organizations, it has also affected other services those organizations provide. So examples of those would include things like access to HIV services, malaria, family planning, contraceptives. Another effect of the Global GAG Rule was published by a Stanford study between the years 2001-2009. And what they found is that there has been a dramatic increase in the number of abortions done in 20 developing countries. And this is likely due to the effects of the Global GAG Rule that has been in place from that period and is still ongoing right now. An organization known as EngenderHealth has put together a report that basically summarizes the effect of the Global GAG Rule in countries like Nepal, Kenya, and Zambia. To find links and sources for these studies and the effects, the widespread effect of the Global GAG Rule, check the links in the description below to access those documents. So my question to you today, what do you think we can do on an individual level to help curb policies that do not factor in the needs of those that actually need it the most and end up having such detrimental effects on the health of women and children? One way that we're trying to do that is to have conversations about things like this. So the more people know about it, the more we can increase awareness about it. Hopefully that can at some point translate into policies that are being made, better policies being made that contribute to the well-being of women and children. In our next video, we're going to be discussing the Global GAG Rule in the context of the themes of the New York Times bestselling book, Children of Blood and Bone. If you haven't read that book, check it out. It's amazing. So using that book as our framework, in our next video, we will be discussing the effects of the Global GAG Rule, but we would also be using the quotes in the book to discuss ways that we can rise above these inequalities. So stay tuned and comment your thoughts on this issue that's going on. I hope you would like and subscribe and share this video. Okay, bye.